Dental anxiety is something that prevents people from going to the dentist for decades or even their whole life. Today, we're going to go over some tips to hopefully help alleviate some dental anxiety. My name is Heather. I'm a dental hygienist for the past 8 years, and I do see a lot of patients with anxiety. So I feel like I could give a couple good points here. So the first thing is make sure that you tell your provider that you have anxiety. Writing it on the form is great. That, all those medical history forms, that's going to be a question on the questionnaire, but verbally tell the front desk, verbally tell your provider that you're a little bit nervous for the treatment or, just even for the initial appointment. That way we can cater to your needs. We can't just assume that everyone has dental anxiety. So we want to make sure, I kind of assume that a lot of people have anxiety because a lot of people do have dental anxiety. So I tend to handle everyone with care, but I'm not going to be your provider. So I just want to make sure that you guys tell your provider that you have dental anxiety so they can be a little bit more mindful during the appointment. Now, if you are coming in for a cleaning appointment, I would highly recommend you ask them if they have topical, and that is a numbing jelly for your gums. There'll be no needles involved. They'll take a Q-tip and rub a jelly on your gums, and that'll help numb your gums during your appointment so you really won't feel any. Make sure you don't swallow this gel because that gel can go to the back of your throat and it could feel like that you can't swallow, but my patients do really well with it. I just rub it on their gums, make sure that they don't swallow it. I suck it all out with the suction, and then patients are much more comfortable during their appointment. They're not scared that, they're not just sitting there waiting for it to hurt because everything is numb. If you are super numb, if you have a lot of gum recession, we can use local anesthesia, but a lot of my patients do really well with just the topical jelly. Another tip would be to find a dentist that does sedation dentistry. So coming in for your cleanings, we can maybe use nitrous, maybe we can do the topical jelly and you'll be fine. But for patients that have severe dental anxiety, sedation might be the best for you. And getting acquainted with a provider from the very beginning that does have sedation options would be best, because you're going to get comfortable with the staff, and then maybe you need a filling, and then that wouldn't be okay for you to do under just regular treatment. You wouldn't want to have to find a whole nother provider that does sedation dentistry. So go to an office that offers sedation dentistry, and they'll have all different types. There's types that you just have, it's a pill sedation. They'll have IV sedation. They'll do the nitrous. So there's different levels of sedation. So it doesn't mean you have to be necessarily knocked out. You can be if you want, if the treatment's more extensive, like if you need an extraction or an implant. But if it's just a filling, a lot of patients do really well with nitrous. Now, another thing I would say that really helps when patients have anxiety is staying consistent with your home care routine. A lot of anxiety comes from embarrassment and feeling like their teeth might be dirty. So making sure that you keep up with your routine so you feel nice and clean before your appointment helps with your own anxiety. But I will tell you that we see everything, and we don't care if there's food debris in your mouth. We don't care if there's plaque. We're here to help you, and we don't judge. We really see it all. So even if you think you're the worst, you're not. And we don't care if you are. So just have faith and trust in your provider. Find a provider that does sedation dentistry. Tell them, make sure you're taking care of your teeth at home, and hopefully, checking off those boxes will help alleviate some of your anxiety. All right, that's it for today's video. Again, my name's Heather. If you guys have any questions, leave them down below, and I'll catch you guys in the next video. Okay, bye.